There's a health warning out of Ohio this week after a rise in childhood pneumonia cases. Some are calling it white lung syndrome. We're going to get to that in just a second, what exactly that is. I want to talk to Dr. Florin with Lurie Children's Hospital about this. He is in charge of pediatrician. He's a pediatrician at Lurie Children's Hospital. Hello to you. Thank you for joining me.
Thanks for having me, Lourdes.
All right, so it seems like, at least around here in our newsroom and all my friends, I feel like everybody's been sick, not just for like a week or two, but they have this sort of lingering cough that seems to last for weeks. Is it something out of the ordinary, or is this something that happens sort of every year and we're just sort of overreacting to it this time around?
Yeah, no, it's a great question. I think we're all hypersensitized after what we experienced as part of the COVID-19 pandemic. And I can reassure you that this is a very common experience that we are all having, including myself and my children. Prolonged cough and respiratory infections, perhaps a case of pneumonia. This happens on every year on a cyclical basis. So every winter, we have an onslaught of respiratory viruses and bacteria that can cause these types of infections.
So when they say this warning that came out of Ohio, where they have a large number of cases all at once, is that related to this? Should we not be concerned about that?
So the report out of Ohio was that 140 somewhat children, had pediatric pneumonia, and that led to some media outlets reporting this white lung syndrome, which honestly is a colloquial name for when we get a whiteout in the lung, or something called acute respiratory distress syndrome, which is actually a very rare complication of pneumonia. There's been no reports that I have seen that these cases of pneumonia out of Ohio are these severe forms, but rather just a cluster of lower respiratory infections that occur commonly in children. And it may be that because we are now in respiratory viral season, that there just simply are more of these cases in this one area, though I'm certain that the epidemiologists are investigating to try to understand the cause better.
Okay, so the next step would be how to treat it, right? So what would you tell a parent who brings their child in and says, or an adult who comes in with a cough that's lasted, weeks on end, how do they treat that?
Right. So, most of these are viral infections, so antibiotics are not going to be helpful. We're seeing a lot of RSV. RSV is on the rise. It has not yet peaked, so it may get worse before it gets better. Influenza is still fairly low in Chicago, but I guarantee you that we're going to be starting to see influenza in the weeks and months to come. Most of these, again, are viral. So things like honey, tea, fever-reducing medications, staying up to date on your immunizations, things like RSV immunization if you're eligible, flu immunization, COVID vaccine, in addition to just washing your hands and not going too far in public if you're sick. So if your kids are sick, if they're throwing up, if they're having diarrhea, if they have fever, they should stay home from school until those symptoms start to get better.
All right, all good advice. Dr. Florin, I appreciate your time. I've got my tea right here, okay? I'm ready.
Perfect. Thanks,
Thank you,
Lourdes.
sir. Have a good evening.
Have a good night.